Hi, nurses. So, today again, I've come up with another NCLEX Next Gen question for you. So, you can see on the screen, we have NCLEX Next Gen question. May first, I have explained earlier also that there are two categories. One is when you get a patient scenario with different information about the patient. Along with that, it is followed by six questions. And the second category is when you get a patient scenario followed by just one question, right? उसको हम बोलते हैं आर एन स्टैंड अलोन टाइप ऑफ क्वेश्चन विच इज़ ऑन द स्क्रीन राइट नाउ सो वी विल टेक स्टैंड अलोन क्वेश्चन today. Let's see what is the question is. The home health nurse is caring for a 2-month-old client. So, home health nurse visits are usually done for babies after like they are born for some time. In case when the baby is discharged with a low birth weight or some any kind of medical issues, then sometimes follow-ups are done by the home health nurses. So in this case, patient or baby is just 2 months old. So different kinds of notes have been made by the nurse for every weekly visit, right? So in the first weekly visit, client means the baby is sleepy. Parents report that the client breastfeeds on demand approximately 8 times daily, which is okay. Usually 8 to 12 times daily on demand breastfeeding babies do take, and this is fine. But here the baby is sleepy also. That has to be noted. Then weight is below the fifth percentile at 7 lb or 3.2 kg, and physician has been notified. So you can see that baby is taking on demand breastfeeding 8 times, which is fine, but still the birth weight, if we see now at 2 months of age, it should not be so low. 3.2 kg is very low, and the baby is sleepy also. So there is definitely some issue. Then on the second visit, the baby or client is alert but irritable. Again, there is a problem and it has gotten worse than sleepiness. Parent reports that the client breastfeeds on demand, fluctuating from 6 to 8 times daily. So it has reduced from 8 to 6 to 8. Weight is again below the fifth percentile at 6 lb 9 oz 3 kg. So it has further reduced from 3.2 kg. Now the baby in the next week is just 3 kg. So there is a problem with a 6.3% weight loss. Parent is visibly upset after viewing client's current weight. Physician notified. So in any case, if any one of you has doubt in the kg lb units, so always remember 1 kg is 2.2 pounds or lb. So accordingly you can calculate if in some questions you have doubt, right? Then on third weekly visit, client has become lethargic. So from sleepy in the first week to irritable in the second week, now in the third week the baby is lethargic. So that clearly shows his condition is deteriorating. Parent reports that the client is still breastfeeding on demand, fluctuating from 6 to 8 times daily. Weight remains below the fifth percentile at 6 lb 2 oz or 2.8 kg, which is further like the weight has reduced with 12.5% total weight loss. Physician contacted because now we can see that condition of the baby is constantly deteriorating. Now we are awaiting orders. So this is the whole scenario of the patient. So important points are that he is taking breastfeed on demand. Earlier it was 8 times daily, then it came down to 6 to 8 times, right? And the weight is also reducing from 3.2 kg. Now it has come down to 2.8 kg. So we definitely need to intervene. Now the question is, drag words from the choices below to fill in each blank in the following sentence. So this is a kind of next gen question. The nurse should anticipate that physician will instruct the parent to dash and dash. So this kind of two boxes you will get. You have to just click on first box. ये drop down box आ जाएगा and you have to select one option from here, any of these options, and you have to drag it to the first box. फिर आप second box पे click करोगे. Then when you click, you get a drop down box again. एंड देन यू पिक अप वन ऑप्शन, क्लिक करके उसे ड्रैग करना है आपको सेकेंड बॉक्स तक. तो ये नेक्स्ट जेन क्वेश्चन का एक पैटर्न है, वन ऑफ द पैटर्न्स, राइट. So I hope pattern आपको clear है. Now the answer. So after this case scenario, the nurse should anticipate the physician will instruct the parent to do what of out of all these, which two options? Fortify the breast milk, complete a feeding log, feed the client formula for 2 weeks, increase the parent's caloric intake, or consult a pediatric surgeon for placement of gastrostomy tube. So out of these five options, you have to choose two and put up in these two boxes. So first formula for NCLEX questions जो आपको use करना है, first you should just remove the options which clearly are not the answer. You have to choose. How you will choose? See, first is complete a feeding log. Already feeding log means maintaining how the baby is taking feeds, how frequently, which the parents are already doing. They are very accurately reporting that the baby is taking 8 times or 6 to 8 times. So we don't need to do this now. This is already being done by the parents. So complete a feeding log. Second option will be eliminated. Then this option, last one, consult a pediatric surgeon for gastrostomy. So usually gastrostomy का इस सीन में कोई भी requirement अभी नहीं है फिलहाल. Why? Because usually gastrostomy will be done if the baby has some congenital anomalies in upper GI or lower GI, some kind of obstruction is there, or the baby's weight is less than third percentile, but in our case it is just below fifth percentile, so still we have time to take other interventions. We don't need to do gastrostomy at this stage. या फिर बेबी के केस में इफ़ ओरल फीडिंग इज़ जस्ट नॉट पॉसिबल, वो भी यहाँ पे नहीं है, बेबी इज़ टेकिंग ओरली द फीड्स, और द बेबी completely shows failure to thrive, वो भी यहाँ पे नहीं है. ही इज़ ऑन बॉर्डर लाइन बट ही इज़ टेकिंग फीड्स ओरली, सो अभी हमें गैस्ट्रोस्टमी वाला एलिमिनेट कर सकते हैं. Then this third option, feed the client formula for 2 weeks. This will also not be required at this stage. Why? Because mother ka breast milk baby is getting, no, so we don't need to add the formula feed. What we can do is, we can do two options will be correct. First one, fortifying the breast milk and increasing the parents or mother's caloric intake. So these two options you will put in these two boxes. You will click on fortify the breast milk and drag it to first box, and then click on increase the parent's caloric intake and drag it to the second box. Now, how we are going to do this? If you are not aware what is fortifying, fortification जैसे हम बाकी food items की करते हैं to increase their nutritive value, similarly in case of mother's breast milk also, fortification can be done by using a commercially available human milk fortifier या HMF बोलते हैं उसे. Because breast milk is available, baby is taking orally, so we just need to improve the quality of breast milk, right? So two things we can do: adding HMF or human milk fortifier to the expressed breast milk of the mother, which will increase its nutritive value. So examples हैं commercially available HMF के. One is Similac and Enfamil. Similac is one example, and Enfamil, और इनको बोलते हैं HMF, human milk fortifier. So this can be added. These human milk fortifiers, they increase the calorie, protein, calcium and phosphorus content of the breast milk, and usually they are given in case of preterm babies or babies who have very low birth weight or who are not showing any good improvement in their birth weight gain from the birth weight, which is also in case of our patient. So one option is fortifying the breast milk. Now, second option which we have chosen here is increase the parents or mother's caloric intake. So ideally in any lactating mother, she needs around 2200 to 2500 kilocalories per day. Like you can say around 4 to 500 extra kilocalories per day is required by lactating mother for the first 6 months. So how we can increase parents caloric intake? So answers are fortifying breast milk and increasing parents' caloric intake. But sometimes you can get a question like how you can improve the parents' mother's caloric intake. So many times in NCLEX questions, you also get questions related to the food items. What kind of food items you should add, or maybe a food item's name will be given, and you have to pick up from that. या फिर आपको already पता है कि ये food item देनी है, but how much? So it's very important. So just few examples I will give how you can increase the mother's caloric intake. First is energy dense foods should be added to her diet. Like we can add different homemade foods made from sesame seeds, peanuts, or coconut, jaggery. These are all energy dense healthy foods which should be added. Then, second thing, we have to add more protein, right? Breastfeeding mothers need around 75 to 100 grams of protein daily. So, which can be done by paneer, curd, milk. If we talk about milk, sometimes आपको specifically पूछा जा सकता है. So 2 glasses per day is sufficient. Or if you are giving eggs, then 1 to 2 eggs daily. Then she should take legumes or lentils, specifically chickpeas or kidney beans, soy chunks, peanut butter she can take, right? Then if we are talking about healthy fats for more calories, then she can add mustard oil, groundnut oil in her food, or nuts like almonds and walnuts, flax seeds, chia seeds, etc. Then she also needs to keep herself hydrated. So we should advise her to take 2.5 to 3 liters of fluids daily. She can add coconut water, and warm milk will also hydrate her. And common practice in India is to give cumin water or fenugreek water, that is also good for hydration. So these are kind of interventions mothers should be told about, right? And then her caloric intake will increase. So this is the answer. We need to just fortify the breast milk, increase the parents' caloric intake, right? Feeding log is already being maintained. Formula required is not required right now because we can manage by our interventions like improving the quality of breast milk. And gastrostomy also I mentioned. At this stage, it will not be required. So we will do these interventions, first one, and then this one, fourth one, and then weekly visits will again be done to assess the progress of the child. I hope this answer is clear to you, and this is one example of next gen question. Another type is bow tie question also. So next video I will try to share that type of question or any other next gen question. Hope it is useful for you. So keep following my channel for more such next gen NCLEX question examples. Bye bye.